Hi, this is skill 2.40, administering intramuscular injections. Now for this skill, I'm going to jump right to the actual injection of the medication. Okay, so we've already been in the med room, we've done all our checks, we've come into the room, and now we're with our patient. Okay, so you're going to perform wipes and you're going to explain the medications to the client, right? That's the last safety check. And you're also going to tell them the purpose of the medication. You're going to select an injection site. Now remember, this is intramuscular. If you don't remember where intramuscular sites are, go back to the PowerPoint that I've presented to you and look at the appropriate sites for an IM injection. Okay? You can also look in your skills book that you bought. Okay? Alright, so then what we're going to do is we're going to clean the site. And we're going to clean the site just like we did before. We're going to start in the middle and move out in a circular motion, okay? So that's how we clean our site. We're going to use the alcohol. We're going to give it a chance to go ahead and dry. The more time that the alcohol is on the skin, the more microbes that it is killing. So less likely to have any type of a infection at the site, okay? Alright, so we have our medication and we are going to inject. We're going to select the injection site, identify bony prominences or landmarks. We're going to consider the client's size, amount, and the viscosity of the medicine being injected. We're also going to alternate sites each time that we have to give an IM injection. So you're not always going to give it in the upper right arm every single time, right? You're gonna move it around so that the muscles aren't getting sore. Okay? For an elderly or a pediatric client, you may be going in at a 45-degree angle for an IM because of you know, they don't have as much muscle on them. So if you were to go at a 90-degree angle on pediatric and some elderly, you might go all the way to the bone, and that wouldn't be good. Okay? All right, so we've cleansed it with the alcohol, we've allowed it to dry, and we have our gloves on. Okay? You're going to do is you're going to pull the skin taut. And when I say taut, that means pull it like this, okay? Remember, remember before with sub-Q, we bunched it up. We don't want to do that. We want to pull the skin taut, okay? And then we're going to ensure the needle placement, insert the needle at a 90-degree angle. Again, PowerPoint presentation I gave you shows the different angles for injection. So look at that if you don't remember, okay? 90-degree angle in, quick, in, okay? All the way down, inject slowly and steadily, okay? Slow and steady. And you're going to hold again to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now we're going to withdraw and hold, not rub. There's no rubbing. Just hold the site. Okay? We're going to put the safety on our needle and put that in the sharps container. We're going to make sure that that the site is okay and not bleeding. Okay? We are going to assess our patient, make sure that they are okay. We're going to remove our gloves and perform hand hygiene. We're going to document on the MAR the medication, the route, the date, the time, and our initials. And then we are going to make sure our patient is comfortable before we leave them and do all of our wipes for when we leave, okay? So that is a skill 2.40, administering intramuscular injections.